Hi everybody, welcome to Dr. Manny's YouTube Learnshops. Today we're going to be reviewing perspectives of human behaviour. An important topic, a very important topic in behavioural sciences. The objectives for this session are that at the end of it you'll be able to explain the concept of what human behaviour is, which we touched on briefly previously. Determine the key aspects related to personality and get some sort of insight into what personality and its influence has on human behaviour. And for you to become more self-aware about factors which influence your and other people's behaviour. What's behaviour? We touched on that briefly in the previous session as well. Well, behaviour are actions or reactions of an object or an organism in relation to the environment. Behaviour can be conscious, that you're aware of it. It can be unconscious, you're not aware of it. It can be overt, meaning obvious, or it can be covert, meaning hidden. It can be voluntary, or it can be involuntary. All organisms have behaviours. That's how we recognise who or what they are. So what's human behaviour then? Human behaviour is the collection of actions performed by human beings. And these can be influenced by your culture, your attitudes, your emotions, values, ethics, whether it's in an authoritarian situation, a persuasive situation, a coercive situation, and it can be related to genetic factors. Human behaviour has got certain concepts that we need to be aware of. Human behaviour is related to human life, and this is a continuous process. It's constantly changing or evolving. It can be related to culture, ethics, your gender identity, and this can be facilitated by the perceptions of other people. People play an active role in creating their own experiences. You're responsible. You're responsible for your actions, and as a consequence of that, your experiences. However, it is important to remember that human beings are very, very different, even though they're exactly the same. The same biologically, but different in relation to our individual personality. Our behaviour is influenced by many, many, many different things. Here are some examples of human behaviour, and there are many. Hugging, sleeping, dreaming, communicating. Not everybody likes to hug. Most people do sleep. People do communicate, sometimes effectively, sometimes not effectively. Laughing, being aggressive, lying, as in not telling the truth. Sometimes you can be violent. You can be dishonest and cheat or steal. You can be nasty and aggressive by being a bully. You can have certain habits that are possibly not accepted. Gambling, gossiping. You may have suicidal tendencies, or you could want to murder somebody. You could be involved in war. These are all examples of human behaviour, and there are many, many more. Human behaviour is often characterized as human nature. This is an interesting concept. I mean, what do we mean by human nature? What is human nature? Sometimes it's quite scary. Here are just some quotes or some references to let you have an idea of what human nature is. I guess it's just human nature that we tend to remember those who hurt us more than those who made us happy. We seem to remember the negative rather than the positive. People are more likely to remember the bad rather than the good. Remember that. Atrocities are human nature. They don't have political beliefs, colour, creed, or anything like that. They just happen. It's human. It's saying here, we do bad things to people. Not for any other reason other than the fact that human beings like to do it. We'll be looking at examples as we go through to rectify and validate what these are saying. It's our nature. Human beings like success, but they hate successful people. I mean, everybody pushes it. Everybody pushes the fact here that it's important to be successful. And it is. It is indicated that once people become successful, other people don't like it because they are not one of the successful people. Human nature at times is unfortunately very ugly. And I learned the world can be a very ugly place. For as much beauty there is, there's just as much brutality and violence and ugliness. All you have to do is look around the world currently, whether it's in Europe, whether it's in Asia, whether it's in America. It's very sad. People are essentially not very nice. And given the opportunity to be good or bad, many, many human beings are bad. Human nature has been sold short, according to Abraham Maslow. Humans have a higher nature which includes the need for meaningful work, for responsibility, to be creative, for being fair and just, for doing what is worthwhile and preferring to do it well. Very positive attitude in relation to human beings. We'll be discussing Maslow as we go through. Human nature is like water. It takes the shape of its container. What exactly does that mean? Well, basically what it means is people act the way they act depending on a situation. If they're placed into a situation that is potentially bad, they adapt to it and they become bad. If they're placed into a situation that is good or nice, they take the shape of the container and they act in exactly the same way. So human nature basically depends on, it's saying, possibly your environment, which we'll be discussing as we go through. Here's an example, human nature. A class full of children are noisy at school. The teacher tries to discipline them by speaking in a loud, scolding voice. The children become quiet. This tactic works while the teacher is present, but as soon as she goes out of the room, the children become loud and disruptive again. Why? This is because a child's mind is more reactive than being analytical like an adult. This is human nature. Children just are reactive. They're evolving. Example 2. You'll experience this. I hope you don't become one of them. A nurse gives medication to a patient for the patient's disease process, and that's hypertension. The doctor's prescription is written very, very clear. The nurse, however, doesn't check the patient's identity, which is recommended and mandatory according to hospital policy. And as a consequence, the nurse gives the patient the wrong medication, a medication error. Why did she do it? Why didn't she do what she was supposed to do? Is it just human nature not to care? A long time ago, approximately 150 years ago, Florence Nightingale had a concern. And her concern was that the greatest threat to patient safety were the frailties of the human condition. So basically what she's saying is that patients are put at risk by us because human beings have issues about doing the right thing, about not caring. The frailties or the inadequacies or the problems associated with being a human being. Here's an example which we'll be looking at as we go through, and you'll probably encompass it in other courses as well. There was a professor, an American professor, Philip Zimbardo, who's known for his 1971 Stanford prison experiment. And what he did, he placed students in a mock prison in Stanford University. Some students were assigned to act as guards, or policemen, if you like, and others were assigned to be prisoners. After the experiment commenced, bad things started happening. The experiment had to be stopped after 6 days because the guards were being cruel to the prisoners, promoting physical and psychological cruelty and torture. The prisoners were also being very aggressive to each other, hurting each other. Now remember, these are not guards and these are not prisoners. They were students who were actually friends with each other. The question was, why were students so cruel to each other, even though they were friends outside of this experiment? Human nature. If humans are placed into a situation, they will adapt to it. There was a famous book called Lord of the Flies. And in this book, which was based on a reality situation, children were isolated on an island after their ship had been bombed during the Second World War. The children reverted after a period of time, because there were no adults there, into very primitive beings. And they became very, very cruel to certain other members of their team or their school, and they actually killed one. Human nature. So what is human nature? Human nature is the established logical characteristics which includes behaviour that all human beings have in common. It's what makes us who we are. It's what makes us human. It consists of the following behavioural components: personality, attitudes, motives, values, abilities, intelligence, and perceptions. Questions that I want you to consider are, why are most parents devoted to their children? Why do people have phobias about gender differences? Why are some people scared of the dark? Why are children instinctively scared of bugs, spiders, moths, flies? Why are people fearful of people with different cultures or religions? Why do children bully kids that are smaller or different? Also, consider the following. Have you ever met a person who you didn't understand? Their behaviour, for example. Have you ever yourself been misunderstood, unappreciated, undervalued as a person? Have you ever been upset by people who looked at you, behaved and thought differently to you? Have you ever looked down or been unkind on someone who looked, behaved and thought differently to you? I'm sure you all have. I'm sure we all have. Human nature. Now we're going to look at the stages of the human lifespan. And each stage has got a different behavioural experience. In the early years, between 1 to 4 years of age, we're looking at infancy, which is typically 1 to 2 years. And this involves behaviours that involve love and care. And if it's provided, the infant will develop emotional stability. As they progress into the toddler stage, which is typically between 2 and 4 years, behaviours that are required are loving, feeding, weaning, being clean, being scolded, and being punished. And all these pertain to learning about friendship, determination, influencing others, and being competitive. And this is preparation for further life, which builds character, habits and skills. This is your personality beginning to develop. And the early age is very, very important in this stage. When you go to school, typically this is between 5 and 12 years of age. In Malaysia, it's a little bit older, typically starting at approximately 7 years of age, from what I understand. But from the typical European or Western, school starts when you're 5. I started school when I was 5. I matriculated when I was 17. I started nursing when I was 18. So school years are typically between 5 and 12. Early school age, the behaviours and learning relate to oral and written communication. You learn various subjects depending on the curriculum. In groups, you learn good and you learn bad behaviours. Personality is developing. When you get to middle school age, the behaviours and learning that you are exposed to or develop are about academic success. You want to be the best, I hope. You care about people of different gender, age, ethnicity and religions, I hope. There's equality and independence and freedom. And you begin to develop leadership qualities. Personality development is evolving. During adolescence, puberty, 13 to 25 years of age, the behaviours and learning that you have are more independence, possible confusion regarding the stage of life that you're in, because you're in a transition phase. Are you a child or are you an adult? You're evolving. You're becoming physically different. There's maturation of your sexual organs. There are hormonal changes. And you may be subject to peer pressure. Could be cigarette smoking, alcohol, drugs. I hope not. But you are. When you reach adulthood, this is considered to be approximately 25 years and older. There are 3 stages: early adulthood, middle adulthood, and late adulthood. In early to middle adulthood, you acquire further adjustments. You start working. You may get married. You may have children. If you've got no problems during these stages, your personality remains stable and well adjusted. If you've got problems, then personality may become unstable and disturbed. When you achieve late adulthood, the experts indicate that there are no further adjustments. I'm not sure from my perspective whether that's true, because in late adulthood there may be other factors that influence your personality, which we'll discuss as we go through the course. Now let's consider personality. What is personality? Personality basically is you. It's what makes you, you. It involves or encompasses all the traits, characteristics, idiosyncrasies, which are unique things about you that make you different from everybody else. The American Psychological Association defines personality as individual differences in characteristics or characteristic patterns of thinking, feeling, and behaving. It's what makes us who and what we are. But how do we become us? Looking at the images there in front of you, what makes a genius like Albert Einstein? Or what makes a serial killer? And there are numerous. There are certain personality development theories, and these are just some of them that we're going to be looking at over the course of this program. You've got Hans Eysenck's biological personality theory, and he believed, and his wife, that behaviour and personality were related to genetics. Then you've got Sigmund Freud, his psychoanalytical theory, and he believed that behaviour depended on 3 factors: the id, the ego, and the superego. Then you've got Erikson's psychosocial developmental theory, that personality is age-related to developmental tasks, and he identified 8 stages of conflict. Then you've got Abraham Maslow's Humanistic theory, which basically stated that there's a desire to satisfy basic needs to achieve growth and self-actualization, or the best that you can possibly become. Then you've got Gordon Allport's trait theory, and he believed that behaviour formed formed three trait characteristics: the cardinal, the central, and the secondary, which we'll be looking at. Eysenck's biological theory, on the basis of personality, he believed was influenced by genetics. And he had two dimensions of higher order traits, which he called extroversion versus introversion, and emotional stability versus neuroticism, or emotional instability. Freud, on the other hand, had a psychoanalytic theory. And in this theory of personality development, he argued that personality is formed through conflicts among three fundamental structures in the human mind: the id, the ego, and superego. And we'll be looking at all these in more detail as we go through the course. Then you've got Erikson's psychosocial theory, which consisted of 8 stages. And he proposed that we all encounter certain crises in our life that contribute to our psychosocial growth throughout our lifespan. He presented 8 stages of psychosocial conflicts. Then you've got Maslow's hierarchy of needs, the Humanistic theory. And this is used to study how humans intrinsically partake in behavioural motivation. It's a motivational theory. And this means that in order to motivate, or for motivation to occur at the next level, each level of behaviour has to be satisfied in order to go from one to the top. Allport's trait theory, he identified thousands of personality traits and he grouped them into 3 categories: the cardinal, central, and secondary traits, which describe people according to recognisable traits of personality. Cardinal traits, for example, dominate a person's life. Mother Teresa was famous for what she did, being a humanistic, caring person. You've got central traits, which describe a person such as being kind, sincere, calm, cheerful, angry. Then you've got secondary traits, which are apprehensive traits that only occur in certain situations. For example, if I said to you all here that you're going to have a test, right now you might suddenly become very, very anxious. They describe people according to recognisable traits of personality. Within Interactionism Theory, there are 2 entities, the mind and the body. And each in this theory have an effect on each other. Human behaviour in this theory is influenced by personality traits, the situation, and the interaction between the personality and the situation. It's how people perceive or define a situation, which is critical in their behaviour. Take, for example, now, doctors inform parents of a child that he would never be able to play any physically exerting sport. The child, however, becomes an Olympic athlete and acquires a gold medal. True story. Questions to consider are: how did the parents define the situation? How did the child define the situation? And how did it influence their behaviour? It could have gone 2 ways. The child could have done nothing physically and been sitting around all his life, possibly in a wheelchair. However, he became an Olympic athlete and acquired a gold medal. Look at the Paralympics that occur worldwide with physically challenged athletes. Look at example 2. Doctors inform the patient and the wife of the patient, who is a stroke victim, that he'll never be able to regain his normal activities of daily living. However, the man regains 90% of his normal activities of daily living. Reminds me of my father. My father had a stroke at a very young age because of stressful situations. The doctors told him he'd never be able to do this or that again. My father was very motivated. He worked constantly on himself, pushing himself, and you really wouldn't have known he had a stroke other than a slight facial droop. He could walk. He resumed his job as a master plumber. Questions to consider are, how did the patient define the situation? How did his wife define the situation? And how did it influence their behaviour? To me, it's being positive or being negative. Let's look at personality development now. And personality development is along a continuum. Nature versus nurture. Nature is referred to as being hereditary or biological or genetic. This is to do with the genes, the nervous system, what you are born with. Nurture, however, is to do with the environment and your life experiences. There's the nature versus nurture theory, which we'll be looking at in a lot of detail as we go through this course. Nature basically means genetics, or what you inherit from your parents. And this can be to do with your physical appearance and your personality traits. Then you've got nurture. Nurture refers to what you're exposed to, your environment, your childhood experiences, how we were raised, which involves our social relationships, cultural influences. If you're happy and you're raised in a nice environment, this is nurture. However, if you're raised in an unhappy environment, this is also nurture. The nature versus nurture theory. Which one do you believe? Which one do you think is important in developing your personality? What traits does nurture actually influence? There are general traits, which is dealing with values, your manners, your faith and religion, politics and social views. Then there are your parents. Your parents, they educate you, they discipline you, they teach you responsibility, cleanliness and tidiness, to be generous, and how to deal with authority. Then you've got your peers. Your peers introduce you to cooperation, popularity being important, approaches of interaction between members of the group. These are the traits that nurture influences. This is with experiences. Consider the following. What or who has shaped you? Think about 5 behavioural traits that most reflect your personality. And for each one, think about which has been most influential in shaping that trait? Your parents, your peers, or that you inherited it from your parents? Genetics. Or is it a combination? There's another interesting theory proposed by James in 1950, the Plaster or plasticity theory. And plasticity hypothesis basically said that the personality is very unstable and it changes. The Plaster hypothesis says that the personality is very stable and permanent. And James supported this theory, the Plaster theory, that personality is stable by the age of 20 to 30. Prior to that, it's unstable. And it's during this period of time, from the age of birth to approximately 20, that your personality begins to develop. And this is where it becomes changeable. After 20 to approximately 30 years, it's fixed. It can't be changed. Yeah, just indicating here with our little Mickey Mouse character. Mickey Mouse is certainly older than 30 years, more in the likelihood of 90 years. Then you've got personality models, and the most widely accepted trait model is called the Big Five model. The 5-factor model, because there are 5 factors involved with it. Before we move on to that, let's consider, is this personality trait good or bad? I want you to remember that the experts or the academics state that there are no good or bad traits. Each trait has got strengths and weaknesses. However, a personality trait may be more suitable for a given situation. Personality traits may change over time, and behaviour isn't dependent on personality alone. So remember, there are no good or bad traits. Each trait has got a strength or a weakness, and each personality trait may be more suitable for a given situation. The traits can change over time, and they're not dependent on behaviour alone. No good or bad, only strengths and weaknesses. The Big 5-factor model is OCEAN. OCEAN is the acronym. Openness, to experience; conscientiousness, being motivated; extroversion, being outgoing; agreeableness, being agreeable; neuroticism, maybe a little bit crazy. This was proposed by Goldberg in 1993. Open to experience means a person is willing to try new things, and their capability to think outside the box. This is to do with intellectual or having an imagination. And the common traits associated with this are curiosity, imagination, insightfulness, looking at different things, originality, being outgoing and daring, looking at variety, being clever and creative, being perceptive. This is about intellect. Then you've got conscientiousness. Conscientious people are goal-directed. They excel in their ability to work within the rules, they plan, they organise effectively, they are leaders. And common traits include persistence, ambition, being thorough, self-discipline, consistency, reliability, being resourceful, working hard, working smart. Energy, persevering and planning. You can learn a lot from this to promote your next 4 years. Then you've got extroversion. This factor concerns where an individual gets energy from and how they interact with others. Extroverts get their energy by interacting with other people, while introverts isolate, they replenish their energy alone. Extroverts act rather than wait. Common traits include they're sociable, they're assertive, they're happy, merry, outgoing people. They're very friendly, got a lot of energy, they talk a lot, they're articulate, they're fun-loving and they're affectionate. Then you've got agreeableness. And this factor concerns about how well people get along with each other. They're liked, respected, and they're sensitive to the needs of others. Common traits include kindness, altruism, unselfishness. Florence Nightingale was considered to be altruistic. Trust and loyal. Modest and humble, patient, tactful, polite, helpful, sensitive. They're cheerful, they're considerate. Neuroticism, well, this is a factor related to a person's confidence and self-belief in their abilities, and it involves emotional stability and overall temperament. And neuroticism tends to be associated with being self-conscious and unsure of yourself. And common traits include being clumsy, pessimistic, negative, moody, jealous, irritable, fearful, anxious and nervous, very timid, wary of everything, self-criticizing yourself, lacking confidence, insecurity, and being oversensitive. I want you to consider the following. Can you identify a personality trait in the following that you perceive as a weakness, but then you think of a different situation where it could be utilized as a strength? You're converting a weakness into a strength. Positivity. Weakness as a strength. Here's the weakness. Talks too much, perfectionist, rigid, pushy, likes to work alone in isolation, procrastinates, wastes time, bossy, do it my way or no way, dreamer, being unrealistic, sensitive, just a follower, a sheep, not a leader. If you convert them to a strength, talks too much, well, that's a good communicator. Perfectionist, very thorough. Rigid, very disciplined person. Pushy, well, they're assertive. Likes to work alone, well, look, they're independent. Procrastinates, they're just patient people. Bossy, determined. Dreamer, imaginative. Sensitive, insightful and caring. Follows others, supports the team. Weakness converted to a strength. The conclusions then are, a human being consists of both physiological and psychological interacting parts. And they differ as you get older across your lifespan. There are many similarities that we have as human beings in our behaviour, but there's no case of a person being 100% identical to another person. Even twins. Twins are very, very different. They may look the same, but they are different. And this is due to a variation in nature and nurture. Psychology studies confirm that genetics, environment, maturation and learning all contribute to the development of human behaviour and personality. None in isolation. So the discussion topic could be, I'll decide as we go through, which you need to react to in the E-Leap. Does a nurse's personality, values, beliefs and attitudes affect the care that they provide to their patients? Are a patient's health behaviours shaped by their beliefs, social and cultural norms? Does a patient's culture, faith, level of education, past experiences influence their response to accept treatment and care? I'll be posting these in the E-Leap. You can decide to respond. You must respond, only briefly, just a few lines, to reinforce the concept. Whew, that's it. Okay, thanks everybody again. Interested in these Learnshops? Check out some of my other ones. Bye for now.